Oklahoma hit with another surge in cases of COVID-19. The state reporting 456 new cases over the last 24 hours, while hospitalizations are up to 175. Meanwhile, 7 more Oklahomans have lost their lives to the virus. And tonight, a local doctor is calling on the governor to do more about it, leading to a difference of opinion between medical experts. News 4's Caitlin Ogle with the story.
The former Oklahoma State Medical Association president suggesting Governor Stitt declare a new emergency health declaration after the 2020 order expired 3 months ago. But the OSMA's current president saying they need more data first.
A 26% rise in COVID-19 hospitalizations over the last week, with an average of 175 patients in the hospital. That's according to new information released by Integris on Thursday.
The patients that are dying are almost exclusively unvaccinated patients.
The U.S.'s dominant strain, the Delta variant, hitting northeastern unvaccinated Oklahomans hard. Dr. George Monks, former president of the Oklahoma State Medical Association, urging Governor Stitt to order a new emergency declaration, saying it would allow, quote, hospitals more flexibility to increase the number of COVID beds and increase staff.
I'm not convinced that that's the way to go at this moment in time.
OSMA's current president saying health leaders need more information before making a move.
We need strain data. We need that desperately. And the more data we have, we start seeing more issues with the spread, we might change that support and that recommendation.
The State Department of Health planning to discuss variants, breakthrough cases, and give an update on the state's pandemic lab on Friday morning. The state epidemiologist also saying, quote, we will evaluate and communicate with local hospitals and government officials to provide support and assistance if needed, and that they are, quote, sequencing as many samples as we can to obtain a full picture of what is currently happening in Oklahoma.
And Monks also tweeting about vaccine boosters, saying, quote, if I had the one-shot J&J, I would now be getting a booster dose with Pfizer or Moderna. However, according to Dr. Clark, several studies on that are still underway, and right now it's not yet recommended.